Today we have the epic battle of CBD and THC. Who's gonna win? Today we're gonna do an update to our previous video about these cannabinoids. So Blake, talk about CBD. What is CBD and how does it work?
CBD is one of the kind of three main cannabinoids that are produced by the cannabis plant. So you start off with a precursor CBG, and then you have three different enzymatic pathways within the plant. And then it'll either make THCA, CBDA, or CBCA.
Okay.
And so each one of those affects the body differently and mimics a different natural neurotransmitter. In the case of CBD, we're actually mimicking GABA.
Is it working on its own in the endocannabinoid system, or is it working with everything else? Because people take it, right, by itself, and they also take it with other things like THC.
This is the big conversation about entourage. We talked about CBD kind of being squishy and fitting into multiple pathways.
Right.
That's probably a really good way to think about it if we're talking about like pre-college algebra. Right. But if we want to get like harder core and like we want to take a little bit more, really what's happening is if you look at GABA and all the different places that GABA affects in the body physiologically, CBD mimicking GABA affects multiple different things. And so when we start thinking about pairing cannabinoids, you want ones that are affecting different pathways. So if you pair like THC, which is going to affect the precursor anandamide, followed then by dopamine, that's a different absorption pathway than CBD will be affecting GABA, which will also be different from CBC, which will also be different from CBN, which will also be different from CBB, right? And so CBD seems to be, because it becomes the most abundant. Out of all the cannabinoids on the planet, it's the most abundant. And that's because it's mostly found in hemp and people grow tens of thousands of acres of hemp.
For thousands of years.
Right. And so, and THC is restricted. I think there's probably a lot of people who'd be like, that should be the most common cannabinoid. But right now,
well, talk about THC and how does that work? Because that seems to be more restricted to kind of one receptor for the most part.
Yeah. So if we're going to go kind of like just college algebra level, right, or basic biology, so there's precursor molecules that lead towards central nervous system neurotransmitters, right? And so a precursor to dopamine is anandamide. And then anandamide gets manipulated and changed, and then your body produces dopamine.
Pleasure.
That's pleasure. It's the pleasure center.
Yeah.
But you actually have multiple dopamine receptors, and they do different functions. They regulate different things. One of those is just absolutely the pleasure function, but they do other things like helping to regulate thermoregulation, food intake, things like that. And so dopamine is responsible for a lot of stuff. THC mimics certain parts of certain receptor sites, so it doesn't absorb in all of them. It only absorbs in some of them. And so you get the euphoric effect. Sometimes it makes you hungry. Sometimes, you get some of these things, and that's a function of what THC Delta 9 is doing. But we could talk about Delta 8, Delta 10, Delta 6.
Right.
I mean, there's a whole slew of different things, and they all work a little tiny bit differently.
So when we talk about dosing CBD and THC, Kylie, we talk about people who just want to take CBD. And like what's that like, and what's the doses like?
The doses for just CBD are so much higher than if you were going to do CBD with THC. Orders of magnitude higher. 300 to 500 milligrams when you're dosing it by itself seems to be a really good dose for a lot of people. But I find that a lot of my patients, if we give them a little bit of THC, they need 30 milligrams or they need only 100 milligrams, and to kind of get the same feeling out of that CBD. And so they're not using so much so often, because you start to get those really high doses of CBD and you get brain fog or you feel extra tired.
And a really high dose of CBD, we're talking 600, 900, 1,000 milligrams.
And really, look, not all CBD is created equal. In fact, THC is better regulated than CBD is. And so you may need 600 from somebody who's created dirty CBD.
From
versus
the shop
That's
down the
true,
street.
too.
so it's always interesting to me that, when people start talking about like the differences in dosing, I agree with everything you've said, but a lot of that's a function of creating it and less about the CBD itself. Because, when you look at like a straight isolate of CBD,
Mhm.
less than 25 milligrams in a typical adult is non-functional. It doesn't do anything. But the reason you need a little bit more of the isolate versus these other than combinations is because if you look at GABA and all the different receptor sites that GABA affects, you're spreading that CBD out into more receptor sites.
Right.
So it takes
So
a
you need
higher
more.
dose
Yeah.
to affect more things, right? Whereas if you are affecting multiple pathways, then you don't need as much to do so. And so that's kind of how that works.
So CBD can be used a lot for anxiety, chronic pain, and those are really the two biggest things that people use it for. Other than high dose seizures is another really common thing. Neuropathic pain, I think specifically from a chronic pain standpoint, you can use it for both physical pain and neuropathic pain. And like I was saying earlier, there are CBD is kind of the sandpaper to THC. So some of the effects of euphoria and like disassociation that you get from the THC, also the physiologic effects of your higher heart rate and your blood pressure going down, CBD can smooth those out. We're basically telling people you really need to take some CBD with the THC.
Even if it's just a little bit.
Yeah.
So this is really, really interesting because physiologically this makes a lot of sense, right? So when you look at this, we're now going to go to trig, college trig.
Here we go.
Okay, we're going a little bit deeper now.
But I see the smile on your face.
I get
too.
excited. I get excited by this stuff. But you look at, so dopamine uptake is partially regulated by GABA. So since CBD inhabits GABA receptor sites, you downregulate THC absorption in the dopamine pathway by having more CBD present. So if you start having, the negative effects of paranoia, you've taken too much, you've overstimulated dopamine, downregulating that with CBD is the right way to do it. And the way it does that is not occupying the same receptor site. It literally, GABA is inhibiting reception of the THC molecule.
THC.
So it's kind of cool.
So when it comes down to whether CBD or whether THC, I think today we've learned that if you're going to take CBD alone, you're probably going to need higher doses. And to Blake's point, you're going to need to make sure that you're using CBD that comes from a reputable tested source. If you're going to add THC to that, it's a good idea to lower the CBD dose because you probably won't need as much because of the entourage effect, which we're going to talk about in our next video. So stay tuned. Any comments about CBD or THC or how you're finding they work together, we're always excited to hear the stories, and we always respond to all your questions below.